So some of the things I find that a lot of patients are surprised by when they come in for their initial consultation for an implant is that we address full mouth health. I don't want to put something in an environment that has a risk for failure. I don't want the patient to have to go through additional surgeries if their mouth isn't already healthy. And so one of the things I find a lot of people are surprised to know is that they already have active gum disease that isn't being treated. Whether it's due to an extended period of time since they've seen a prior dental provider, whether it's being currently treated by a provider that isn't addressing active gum disease. So there's several factors that play into that. But I have had a lot of patients come in and they're surprised when we start talking about the level of health in their mouth before we get to the point of putting in an implant, because active gum disease creates such a high risk for implant failure. And that's one of the initial phases that I like to see stabilized prior to an implant. So I think that's probably one of the big red flags when it comes to implant dentistry. You can put an implant in almost anywhere and it'll almost always integrate. That's the irony of it. Like, I don't know what it is about, like, you send someone to an oral surgeon and you don't give them enough information and they'll put an implant in someone's head just because that's where they had enough bone and it'll integrate. It's not where you want it. It's not aligned. That's where it'll take. If you're specific about where you want it, then that's usually where they're like, oh, implant failed, not enough bone, whatever the reason was. And that's not always the case, but like for whatever reason, and that's kind of like the running joke in dentistry is like you find the perfect spot, you align it, you do all your homework, and that's not where the implant, right. Like that's not where it wants to live, right? You do all your homework and oral surgeon throws it in just because like that's where the bone is and that's where the implant likes to grow.